So you want to know if the prostate exam is accurate? Well, this video will tell you all about the prostate exam and whether or not it's accurate. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your healthcare needs. By the way, if this is your first time on the channel and you like fact-based healthcare, go ahead and subscribe below. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. So let's go ahead and sort fact from fiction. But first, let's review and see how trustworthy most medical information is. So a major problem with healthcare is that it's financially driven and plagued with exaggerations, scare tactics, and misinformation, and with financial conflicts of interest. As well, most published research is false, and only about 11% of medical treatments are of known benefit. In fact, much of healthcare is of unproven benefit, despite being labeled as FDA approved in medical guidelines, gold standard, standard of care, and so on. Sometimes it can be very difficult for patients to wrap their head around these facts that tests and treatments can be recommended by physicians but be without any evidence for safety or benefits. Again, the references to all this material are in the description below. So because some prostate cancers can feel hard, the prostate exam became a test to determine whether or not there were any abnormal areas to be felt in the prostate. But before we start, let's check and see exactly where the prostate is located. So you can see exactly where the prostate is located, in front of the rectum and just below the bladder. In fact, the urinary channel passes from the base of the bladder through the middle of the prostate and out through the urethra. So how is the prostate exam actually undertaken? So the prostate exam is also known as the prostate check, the prostate touch, or the digital rectal examination, and it's performed with a gloved and lubricated finger. The patient can be lying on the examining table with legs drawn up or standing and bent over the examining table, and you may here assume the position. The finger is gently inserted through the anus into the rectum and then directed anteriorly or to the front to feel the prostate texture through the rectal wall. The exam can be a little uncomfortable or even painful if there's an anal fissure or some anal narrowing after previous hemorrhoid surgery. The practitioner then attempts to feel the texture of the prostate by applying a little pressure to determine if there's any firmness, induration, irregularities, or nodules, as sometimes such findings can suggest a cancer. So how accurate or how reliable is the prostate exam for detecting a possible prostate cancer? So a lot of what practitioners are feeling is according to an estimate or a judgment of what they're feeling. Essentially, the test allows the practitioner to feel only the back wall of the prostate, so anything in the front part or in the middle of the prostate is likely to be missed unless the nodule is very large. Furthermore, irregularities need to be at least half to a centimeter in diameter before they can be routinely detectable. And of course, the deeper the nodule, the bigger it needs to be before becoming detectable. Importantly, the test is highly unreliable because what feels firm to one practitioner may not feel firm to another. And it's important to realize that most prostate nodules are benign due to BPH or prostatitis, and that only some are cancerous. So clearly there's a big problem with the reliability of the prostate exam. But what's even of much greater concern is that an abnormal test almost invariably leads you to more very unreliable and very risky testing. So not only is the digital rectal exam or the prostate exam highly unreliable and subjective, but if anything is detected by the practitioner, it almost always leads to a very unreliable PSA blood test. The PSA blood test has a false positive rate of about 78%. It's not specific for the prostate or for prostate cancer, and its limits of normal of 0 to 4 are made up and meaningless. Furthermore, the PSA is easily raised or lowered by numerous benign events, and when a cancer is detected, it's usually because the PSA was generated mostly by the BPH and not the small cancer. Another test that's frequently recommended is the 12-core ultrasound-guided transrectal or transperineal prostate biopsy. Although the transrectal method is more risky, both techniques are associated with gross sampling errors. In fact, the 12-core biopsy samples blindly and randomly only about 0.1% of the prostate, leaving you in the dark and clueless about what's in 99% rest of the prostate. And again, both the highly unreliable PSA test and the 12-core prostate needle biopsy test are considered standard practice and recommended by physicians, but are both without any scientific evidence for safety or benefits. By far the best option is to bypass the ultrasound-guided biopsy and get a screening MRI of the prostate undertaken by an expert. Be aware, though, that no test is 100% reliable. So another very important fact for you to understand is that most prostate cancers grow sluggishly and have to have grown for years before becoming detectable. It's also important to realize that although the prostate cancer label is an all-inclusive term, not all prostate cancers are equal. In fact, the Gleason 6 is a bogus cancer, and most other cancers have sluggish growth rates with cell division times of about 475 plus or minus 56 days, meaning that with this rate of cell division, it can take 40 years to get to a growth of 1 centimeter in diameter from mutation. As well, most prostate cancers are outlived, and it's essentially the 10 to 15% of high-grade prostate cancers that are potentially deadly and responsible for the 30,000 or so US deaths annually. So does the prostate exam even meet the criteria for being a useful screening test? So the prostate exam is highly insensitive, subjective, non-specific, unreliable, unsafe as it exposes patients to additional potential complications from other tests, and fails to save significant numbers of lives despite being affordable. So let's return to the original question. Is the prostate exam accurate? In fact, the prostate exam is highly inaccurate. It fails to meet the criteria for being a useful screening test, invariably leads to other unreliable and risky tests, detects mostly cancers that are outlived, and is without evidence for saving significant numbers of lives. So let's recap. In this video, is the prostate exam accurate? In this video, you learned that the prostate exam is highly inaccurate and unreliable. It is prone to false positives and false negatives, and most prostate cancer nodules are not cancerous. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.